Thank you for joining Hawaii Wellness Network, and we're filming you live from Love Peace Harmony Center. And Christina's here
Yes.
from Healing Hands of Kaneohe.
Yes.
And you brought a special guest with you.
Yes, this is Li'i. She's a certified service dog, and she actually works
Right.
with me at Healing Hands of Kaneohe, where we provide clinical massage therapy to patients that have been diagnosed with soft tissue, skeletal, and nerve and joint injuries. And we primarily service the motor vehicle accident claims as well as work-related injuries for workers' comp. So we just want the public to know that if they're ever involved in a car accident or in a work-related accident, that Healing Hands of Kaneohe does accept insurance claims for those types of injuries.
Good to know. Yeah.
Right, because there are very few locations on Oahu, in particular on the windward side, that accept insurance claims for these types of injuries. And it's difficult when you've been diagnosed with an injury to be able to afford treatments 2 and 3 times a week in order to heal.
Absolutely.
So it's nice to know if your insurance is going to be able to cover it, and then who will be approved for those insurance claims. And Healing Hands of Kaneohe can do that for people.
Great. And do you want to talk a little bit, I mean, a lot of people are familiar with massage or had a massage. What is the difference between just, there's all these modalities of massage,
Sure.
but the difference between clinical massage and what are the benefits like working with medical doctors and
Right.
that you can offer to
Right.
people?
A clinical massage therapist is somebody who's trained and experienced in working with patients who have diagnosed soft tissue, skeletal, or nerve injuries. And with that, we read MRIs, we discuss with the physician the diagnosis of the patient, and we work together as a team with maybe a physical therapist or an acupuncturist or a chiropractor to bring about relief of pain for the patient, increase mobility without pain so they can get back to their jobs or get back to their daily duties in their life. And the types of modalities that are used at Healing Hands of Kaneohe, there's 2 specific treatments that I give to my patients, and one is neuromuscular therapy, which deals with the brain as well as the muscle and the skeletal system, and the techniques are used in a way that bring about balance within those different systems. And so you're looking at whiplash, trigger points, nerve entrapment, herniated disc. Neuromuscular therapy is indicated for those types of injuries and many, many more. It tends to be more on the moderate to deep pressure for patients and for clients. And the huge difference between neuromuscular therapy and manual lymph drainage, which is my other technique that I use, is manual lymph drainage is a very light, rhythmic, circular technique that's designed to increase the lymph flow, which helps promote healthy connective tissue. The immune system response is much greater. It relieves pain. It sedates the sympathetic nervous systems, which allows patients to be healing from swelling, bruising, congestion in the system. And so we offer 2 different types of treatments for 2 different types of patients, if you will, and we also combine the 2 techniques as well. Versus if you were to go to a spa, it would be more lomi, Swedish.
Right.
Some of the more traditional things that people go for treatment for. But when you're working with physicians and diagnosed injuries, there are studies that recommend certain types of massage treatments for healing, and neuromuscular therapy and manual lymph drainage are 2 very well-known treatments for diagnosed injuries.
So if someone had diabetes or gout or some circulation kind of diseases and they just want improved circulation, you can help them with that as well.
Right. So in those indications, manual lymph drainage would be very good for swelling, gout, bruising, lack of circulation. A diabetic, typically they get their peripheral neuropathy,
Right.
where the heart is not pumping the blood to the legs and back up to the heart as efficiently. And by doing manual lymph drainage, you will increase that flow and promote the healing that's required.
And how does your dog help with the?
Well, a lot of the patients that come to our office, on top of their injuries, they're actually traumatized by their injury, by the car accident, what they saw, what they experienced, and same thing at their job. And Li'i just has this way of calming patients when they come to our office.
Nice.
And she's always there to greet them And many of the physicians that I work with on the windward side also have service dogs, and so it's just a nice way for another type of environment for a patient that's a little bit relaxing and comforting through an animal.
And she probably loves the energy and being
Yeah,
around
she loves being with people. She likes helping them feel good. We go to nursing homes as well,
Nice.
and hospitals to treat patients who aren't able to come to our office. And she always comes along and brings a smile, and lifts someone's spirit. So she's always at our office. If you come to my office, you will see her as well. And she is hypoallergenic, so you don't have to worry about shedding and being allergic to her. She is a Maltese poodle. And we welcome her very much at our office.
Right. And if there's a physician out there and they, would like to be able to refer you to the clients and get, start a relationship with you, how would they get in touch with you?
Right. Well, they can call my office at 247-1118. They can also go to healinghandsofkaneohe.com and send me an email, and I can come by and bring information to the physician, explain the benefits of what I offer to patients with diagnosed injuries, and that's pretty much it.
And you go on site, or they can come to your place, or do you mostly do on site?
I mostly do on site. I have a ADA compliant office, so I'm able to service more patients who are wheelchairs or caregivers who may be with them. But I also do out calls as well. I go to nursing homes, I go to hospitals, I go to private homes, and I pretty much try to cater to whatever the patient's needs might be and what the insurance will approve.
Well, great. Well, thanks for coming on and sharing
thank you
about what you do.
Well, thank you for having me.
And thank you.
Thank you very much.